Hi, I'm Serap, and I've been having back issues for a really long time. I would say around 15 to 20 years. However, my back pains have started getting worse, where from my lower back it started spreading to my left leg with sciatic issues appearing. So what I did was, once I started getting pains from my left side, I realised that I had to do something about it. So searched online and found Kevin and started my treatment here. I've been having treatments with Kevin for around 2 weeks now, and it has definitely helped me. I am currently free from pain and would definitely recommend you to come to Kevin and do your treatment here before it's too late.
Well, this is very common actually. Sometimes people will come in, a lot of women will have problems with their back, pregnancy, carrying obviously more weight, being less mobile, so they will tend to have more back problems when they have pregnancy, but also they can have a back problem that with pregnancy may ease off because of certain hormones that allow the pelvis to move a little bit easier. However, once the pregnancy is finished, the hormones stop and the problem goes, and it actually is worse because obviously looking after a child, you're now bending and lifting and feeding and changing nappies and looking after a child. And when you're doing that, it does put a lot more strain on the back. So as I warn most mothers to be, that most of their problems are at the start after they have the baby rather than the pregnancy and the birth. That is usually a small part of their life, but the next 3, 4, 5 years of their life and for longer, there's going to be more problems because of the physical strains caused by raising children. And obviously the more children, the more strain there usually is, in lots of ways, I'm sure. Exactly.
Especially she's got 2 boys.
She's twins, she's been blessed with 2 twins, but obviously that's still going to be hard work. And then of course it's not even looking after the children, it's looking after the house. So the cooking, the cleaning, all those things. And these are common things we get patients here with all the time, that because they're bending and lifting, and for example, when they're putting load and pressure on the spine, that pressure will cause the spine sometimes to slip out of alignment. And if the spine starts to move out of position, you end up creating pressure around the nerve. The nerves end up being pinched, sometimes trapped, irritated, inflamed, and that creates pain. Sometimes in Serap's case, in a lot of people's cases, they'll get pain down the leg because these nerves travel from the lower back and down the leg, creating sciatica or pain down the leg, all the way down to the foot in some cases. So to correct this, we need to manipulate and move the spine back into a straight position and realign the spine, removing the pressure from the nerves and getting the spine back to how it was before and removing the cause of the inflammation, the irritation, which obviously in Serap's case is working quite well. So she's gone from being in a lot of pain to being a lot less pain. Serap's an interesting case because she covers 2 things. She does one job that she doesn't get paid very much, and she does another job that she does get paid. So she's a full-time worker, and like a lot of people, she works in an office situation, so she's sitting for long periods of time. She sometimes has to drive to get to work, and again, sitting for long periods of time, whether it's driving, whether it's sitting at a desk working, these create problems. So whether you're in the situation where you work or your mother, in Serap's case she's got both, this creates twice as many problems with the back. So inevitably most people are going to have back problems. But the good news is obviously this is something we can help with and help quite easily and successfully. Yeah. And what is important, what has to be emphasized, that although Serap is doing really well and she's made a tremendous improvement and her pain is mostly gone, that she knows because her lifestyle is still the same. So patients still are going to keep working, they still got to look after their children. There's a need to maintain this, and this is a really important part of the chiropractic treatment. It doesn't just fix problems, it helps prevent problems in the future, and it's about prevention and continually looking after it, whether it's once a month or once every couple of months, to maintain and stop her from going back, because there's no point in trying to fix something and then 2 months later she's back to how she was before. So by carrying on and doing more work on her, which we will, she'll essentially have, hopefully, a lifetime with very little or no pain at all in the future.